Have you ever wondered if the help you're seeking for your child or for yourself might be causing more problems than it solves? In a world where mental health awareness is at an all-time high, this question can feel controversial. We are encouraged to talk about our feelings, to seek professional guidance, and to be vigilant about psychological well-being. But what happens when this well-intentioned system begins to misfire? This is the critical exploration found in Abigail Shrier's work, Bad Therapy. It is not an attack on therapy itself, but a careful examination of how certain modern therapeutic practices, especially when applied to the young, can inadvertently foster dependency, amplify anxiety, and undermine the resilience they aim to build. The goal is not to discourage you from seeking help, but to empower you to seek the right kind of help. As we proceed, remember that successful therapy depends greatly on the skill of the practitioner and the quality of the relationship with the patient. Choosing wisely is the first step toward genuine healing.
Chapter 1: When Healing Harms. The foundation of medicine for centuries has been a simple principle. First, do no harm. When a surgeon makes a mistake, the consequences can be visibly catastrophic. In the realm of mental health, however, the line between help and harm is often blurred. A concept known as iatrogenesis refers to the unintentional worsening of a patient's condition as a direct result of treatment. While a physical wound shows clear signs of infection, damage to the psyche is subtle, complex, and much harder to identify. Despite a significant increase in the number of young people receiving therapy, rates of anxiety, depression, and youth suicide continue to climb. This paradox suggests that the mere presence of therapy is not a cure-all. The quality and method of that therapy are what matter most. When a therapist lacks the necessary skill, several common strategies can backfire. Emotional over-analysis. Constant focus on dissecting negative emotions can amplify them, trapping an individual in a cycle of their own distress rather than leading them out of it. The rumination loop. Endlessly talking about problems can create the illusion of working on them, while in reality, it simply reinforces the power those problems hold. Rewarding distress. In some therapeutic and social settings, talking about struggles often elicits immediate sympathy and attention, while discussing strengths or successes does not. This can unconsciously train a person to adopt a victim identity. Validating avoidance. While a patient's fears feel real, effective therapy should gently encourage facing those fears in a manageable way, not simply affirming them and suggesting avoidance. Promoting hypervigilance. Instructing a patient to constantly monitor their own mental state for signs of trouble can in itself become a source of anxiety, creating problems where none existed. Rushed diagnoses and medications. A quick diagnosis and a prescription can provide temporary relief, but if the root cause is not a chemical imbalance, this approach masks the real issue and can introduce unnecessary side effects. The core message is that therapeutic practices must build a patient's confidence and capability, not their dependence on the therapy itself.
Chapter 2: The School's Well-Intentioned Mistakes. Recognizing the pressures children face, the educational system has increasingly incorporated mental health support into its framework. However, a desire to help does not always equate to knowing how to help effectively. Consider a young girl who trips and gets her shoes muddy on the way to class. She is momentarily upset, but is ready to move on and join her friends. A well-meaning teacher, however, intercepts her, focuses intently on her big feelings, and escorts her to the school psychologist. What could have been a fleeting moment of frustration is now magnified into a significant emotional event. This scenario highlights several systemic problems. School psychologists often operate in a gray area regarding dual relationships. They may know their students' friends, crushes, and classmates, making true confidentiality and professional distance difficult. When an authority figure repeatedly treats a child as fragile or broken, the child may begin to believe it. This can also create a rift between the child and their parents, as a new adult is positioned as the primary emotional expert in the child's life. Furthermore, encouraging a child to share deeply personal feelings with peers is a gamble. The reaction can be supportive, but it can also lead to social stigma and isolation. The system, often overburdened, resorts to broad, one-size-fits-all approaches that can inadvertently teach children to see themselves as more vulnerable than they are.
Chapter 3: The Danger of Learned Helplessness. Perhaps one of the most damaging long-term consequences of misguided therapy is the cultivation of learned helplessness, the belief that one cannot control the outcomes in their own life. This often stems from a misinterpretation of accommodation, which is the practice of adapting the environment to meet a child's needs. Several decades ago, educational aids were a breakthrough for children with severe disabilities, allowing them to integrate into standard classrooms. Today, however, the use of such accommodations has expanded dramatically, sometimes for children with minor or even non-existent challenges. While intended to support, this over-accommodation can have the opposite effect. A neurotypical child who is constantly offered help learns to rely on that help rather than on their own problem-solving abilities. It teaches them to expect less of themselves. For example, if one student receives extra time on a test for a legitimate reason, like dyslexia, another student might lobby for the same accommodation simply to gain an advantage. This not only demotivates the students who worked within the standard time frame, but it also prevents the accommodated student from developing crucial skills like working under pressure and managing time. The same principle applies to discipline. In an effort to understand the root causes of a bully's behavior, schools can sometimes fail to impose clear consequences. This lack of accountability not only fosters a sense of impunity in the aggressor, but also signals to the victim that the system cannot protect them. The result for both is a weakened sense of personal agency.
Chapter 4: The Search for Trauma. It is natural to want to understand the source of our pain, and psychological trauma is a very real and debilitating experience. However, modern culture has a tendency to romanticize trauma, sometimes presenting it as an unchangeable core identity rather than a painful event to be processed and overcome. We see this in popular culture, where a difficult past is often used to explain, and sometimes subtly excuse, harmful behavior. It is crucial to distinguish between a cause and a justification. Two people can experience similar trauma. One may become destructive, while the other may develop profound resilience and empathy. The trauma is a part of their story, but it does not dictate their destiny. Historically, some therapeutic theories suggested that trauma permanently rewires the brain, locking an individual into a state of perpetual damage. While extreme stress undoubtedly has a powerful impact, modern neuroscience shows that the brain is remarkably plastic and capable of healing. Unfortunately, earlier therapeutic models, operating on the idea of permanent damage, sometimes pushed patients to relentlessly excavate traumatic memories. This process, far from healing, often led to re-traumatization, forcing the patient to relive the pain without providing them with the tools to move beyond it. A hypervigilant focus on past trauma can keep a person anchored in the role of a victim, making it harder for them to build a new identity defined by strength and growth.
Conclusion: the path to good therapy. Life today presents unique challenges. Young people are navigating a digital world, academic pressures, and a culture that is intensely focused on mental health. Parents are trying to protect their children in an environment that often feels fraught with peril. The impulse to seek professional guidance is understandable and often wise. The key is to recognize that the goal of good therapy is not to create a safe, challenge-free life, but to equip an individual with the tools to navigate life's inevitable challenges. Just as muscles strengthen through resistance, confidence, resilience, and emotional maturity are built by facing difficulties and discovering one's own capacity to overcome them. Good therapy facilitates this process. Bad therapy seeks to remove the obstacles entirely, leaving the individual weaker. So, what defines bad therapy? Be cautious of any practitioner who rushes to a diagnosis or medication, is inattentive, dismissive, or disrespectful, engages in any form of psychological pressure or control, gives direct instructions on how to live your life rather than helping you find your own path, blurs professional boundaries through dual relationships, fails to uphold strict confidentiality. Your journey in therapy should feel like a collaboration. A good therapist is a guide who helps you read your own map, not a rescuer who carries you. The ultimate sign of success is not that you need therapy forever, but that you internalize its lessons and learn to live independently and fully, secure in your own ability to handle whatever life brings. The best support you can offer a child is not a shield from every hardship, but the unwavering belief in their ability to be strong. That concludes the book summary for this episode. Hopefully, the discussion opened up new insights for you. If you found this helpful, please like